By now, we would have all heard about the coronavirus and how it makes it hard for you to breathe. But have you ever wondered what's actually happening inside the body? In this video, we'll talk about where the virus came from, how it damages the respiratory system, and if it can affect your eyes. Hello and welcome. My name is Dr. Steve. I'm an optometrist from Melbourne, Australia. And if you're new to the channel, remember to click the like and subscribe button to keep your eyes happy and healthy. The coronavirus got its name based on its unique structure that makes it resemble a crown. The shape of these structures act like a key and can only open and lock to a specific type of cell. Once it unlocks the cell, it gets absorbed, replicates itself, and then breaks out. This is a process called cell lysis. Now there are multiple copies in the area, each ready to repeat the process again. So this is how a normal virus infects a cell. So how did the coronavirus that's been in bats for hundreds of years suddenly be able to jump to humans? The answer is called a mutation. This is when the genetic information inside the virus changes either spontaneously, through radiation or chemicals, and alters the structure of the virus. Specifically, when it changes the structures, it acts as a key, it will allow the virus to infect different types of animals. When it's able to jump from animals to humans, we call this a zoonotic disease. And this has happened multiple times in the past. In 2002, the coronavirus was believed to jump from bats to civets to humans, causing severe acute respiratory syndrome. In 2012, it jumped from bats to camels to humans, causing Middle Eastern respiratory syndrome. And now in 2020, we're trying to figure out if it's jumping from bats directly to humans or if there is an intermediate host in between. Okay, so with each disease, we need to have a name of a virus that causes the disease. We named the virus that causes SARS as SARS-CoV. We named MERS as MERS-CoV. And COVID-19, well, COVID-19 stands for Coronavirus Disease 2019. We initially named this as nCoV or novel coronavirus, but then this was changed to SARS-CoV-2 by the World Health Organization. Great, so now we know how the virus jumped to humans. So let's take a look at what it actually does when it gets inside the body. The virus first infects the human body by entering the respiratory system. This can be through air droplets or from your hand touching your mouth and nose. There was some interesting research showing how long the virus can stay infectious on different surfaces. The research shows that when it's in the air, it can last for about 3 hours, aluminium, latex, and copper about 8 hours, cardboard about 24 hours, countertops, plastics, and stainless steel for 1 to 3 days, and glass and wood for about 5 days. And this is why it's important to wear a mask and keep your hands clean, because when it's on your skin, it doesn't really do anything, but if you accidentally touch your mouth or your nose, you can introduce the virus into the body. All right, so once it gets into the body, it travels deep into your lungs, into a tissue called the alveoli. The alveoli contains 2 types of cells, type 1 pneumonocytes, which does the gas exchange, and type 2 pneumonocytes, which releases a compound called surfactant to keep the alveoli from collapsing. Coronavirus likes to infect type 2 pneumonocytes. When type 2 pneumonocytes are damaged, it does 2 things. It releases chemicals to alert neighboring cells that there are viruses in the area so that they can start producing their own viral proteins. It also releases chemicals into the surrounding space to activate white blood cells. In your body, you have 2 types of cells. You've got red blood cells, which carries oxygen, and white blood cells, which help you fight off diseases. The white blood cells then release more chemicals and call for backup. These chemicals also cause your blood vessels to swell, and it starts to leak fluid surrounding the alveoli. Eventually, the fluid moves into the alveoli itself. Now imagine when the alveoli wants to stay expanded so that air can get in, but now it's being surrounded by fluid, putting pressure on it, and then it's filled with fluid, blocking gas exchange from happening. Over time, the immune cells come into the alveoli from the bloodstream. This is when things get even worse. Another type of white blood cell, let's call this white blood cell 2, comes into the alveoli and releases an enzyme that destroys whatever it thinks that's causing the inflammation. So it's basically trying to kill the virus and any cells infected. Unfortunately, this also kills healthy type 1 and type 2 cells. So not only do you have fluid compressing and filling up the alveoli, now you have a reduced number of T1 and T2 cells. This means that there's less gas exchange happening and also less surfactants being produced to keep the alveoli expanded. This is why it's so hard to breathe. Your lungs need to work a lot harder to expand this alveoli. And this is where respirators come in to help get oxygen into the lungs. Over time, when the signaling molecules that recruit white blood cells build up so much in the lungs, it will start affecting other parts of the body. When it reacts with receptors inside your central nervous system, it causes a coughing reflex. When it hits this area called the hypothalamus inside the brain, it causes the hypothalamus to raise the body temperature. This is when you get a fever. Raising the body temperature is a way for the body to fight off an infection. So that's how the coronavirus causes diseases. Now our last question is, can it infect the eyes? The research suggests that coronaviruses are unlikely to bind to ocular surface cells to initiate an infection. However, approximately 0.8% of patients infected with SARS-CoV-2 had signs of conjunctivitis. This is an infection of the membrane that sits on top of the white part of your eye, making it go really red. So in summary, yes, but only if you've been infected through the respiratory route first. There hasn't been any reports of anyone getting an isolated COVID-19 eye infection, which then translated to a respiratory infection. Although this is very possible, and that's why the government has recommended that all healthcare practitioners should be wearing safety glasses when seeing their patients. Okay, so that's it for this one. If you found that you learned a little bit more about COVID-19, please hit the like button. Otherwise, keep your eyes happy and healthy, and I'll see you in the next video.